Hey guys, it's JP, and in this video I will go over what excessive hip drop is in runners and how to address it. During the past few weeks, we have looked at some running deviations that may occur as you run. Now, I will be going over ways to address them, starting with hip drop. The hip drop that I'm referring to is the increased dropping of the opposite hip as the grounded foot is being positioned under the body, otherwise known as the mid-stance phase. I already went over common assumptions to why this running deviation may occur. However, understanding which exact reasons are causing it for the individual runner can be difficult. This is because multiple factors can be involved in causing this. Regardless, the approach to addressing it can actually be pretty straightforward. Typically, I target the core, trunk, and hip region, collectively known as a lumbopelvic hip complex. I incorporate drills and exercises that require these muscles to work in a coordinated manner similar to what is seen during running. This may improve strength and coordination in the area, which may hopefully translate to your running. By doing so, it may optimize the way you move and improve your times as you run. Now, let's go over a few exercises that target the lumbopelvic hip region to help minimize hip drop and improve the way you run. The first exercise I will go over is the bridge with alternating straight leg raises. Many of the exercises I use to address this involve being on one leg. However, this requires the person to be laying down. I use this one particularly to take away the balance demands of being on one leg so you can really focus on engaging the muscles around the area. However, there are a few things to look for when doing this one. First, pay attention to the feet placement. This actually dictates how much you will be engaging the glutes or hamstrings. The farther away you place your feet, the more the hamstrings are engaged, and vice versa for the glutes. For the purpose of targeting the lumbopelvic hip region, we want the feet closer to the body. Now, another thing to pay attention to is the hand placement. Typically, I try to have the person put their hands on their stomach to prevent them from trying to push down on the ground and cheat the movement. Another thing you can look for is making sure the pelvis is level. As the hips go up, you are basically relying on the hip muscles, most notably the gluteus medius, to stabilize your hips without any tilting side to side. If you have limited control and strength in the area, you will see the hip wobble a lot. Now, one other thing to look out for is this leg. To get the most out of this exercise and really challenge yourself, try to keep the thigh in line with the other leg. A common compensation people make when doing this one is lifting the leg too high up, which actually decreases engagement of the hip region. Now, the next exercise we will go over is the lateral toe tap. Shout out to Chris Johnson for this one. I actually try to have the athlete try to master this one before progressing to common exercises that target the side of the hip, like sidestepping. The lateral toe tap is a staple exercise in my playbook to work on coordination and control of the area in a manner similar to running. Let me explain how. First, make sure the knees are bent around 30 to 40 degrees. This is actually similar to how much knee bend occurs during the mid-stance phase, which is where the hip dropping actually occurs. Now, I also have the runner bend a bit from the trunk. Doing so targets less of the quads and more so of the hips, which is the purpose of this activity. Then, gently tap out to the side. As the name implies, it should only be a tap with almost no pressure being put into the ground. Now as you do this, pay attention to the opposite hip, which is the hip that is working. Try to keep this area stable with as little movement as possible. People with limited control and strength may present with excessive sway of the hip. This exercise is typically more difficult than what people initially realize. However, it is a great way to learn how to coordinate the muscles around the lumbopelvic hip region. The last exercise I will go over in this video is a lateral step tap. This is a bit of a twist of the step up. I incorporate this variation of the step up because it not only works on the quads just like the standard step up, but it also further challenges the muscles on the side of the hip. This one engages the quads more than the previous exercises. This can be important from a movement-specific standpoint as the quads are heavily engaged during the mid-stance phase where the hip drop occurs. Also, some research has shown that weakness in the quads or pain in the knee may actually contribute to hip drop. Now, To do this one, all you really need is a step. Since I typically incorporate this to improve strength in the quads as well, I usually cue to have the person keep the body upright instead of bent forward. Then, when you gently tap down, I usually have the person do it with the heel to really maximize the movement that takes place here. If you tap from the toes, it won't be as challenging on the area. And those are a few exercises I use to address excessive hip drop in runners. One more message I want to leave you with is to focus on the performance benefits of this, rather than thinking of this simply to keep yourself from getting injured or solely fixing the movement pattern. Anyway, I hope you guys found this one useful. I'd love to hear your thoughts and what running deviation you want me to address next. And as always, thank you for watching.